jumping straight into the health discussion. Today is World Heart Day, so we're talking things related to your heart, my heart, everybody's heart. If you have any questions once we dive straight into the conversation, send it to 0204-447-033. The WhatsApp number again, 0204-447-033, or you can use the hashtag Sunday Breakfast across all our social media platforms, or my ex at @Ino_S or Jutes at Mensa Duncan, Mensa without an H. To help us with this discussion today is our very own Dr. Carlson Zakaria Adams. Doc, you're welcome.
Thank you.
How are you doing this Sunday?
Very well, I'm fine. And you?
I'm very well, thank you.
Great.
So we're talking about World Heart Day.
Yes.
And let's start off first with, how important is our heart?
Okay. All right. So World Heart Day today, which is 29th of September. It's a day that is marked by WHO and is recognized globally to remind people of our heart health. Okay, and the fact that we have so many cardiovascular diseases, and these cardiovascular diseases which affect the heart and then the vessels. So when you take the heart is like the machine, and then the vessels are the pipes that would help distribute blood as well as whatever that it comes with it. That's your oxygen and then your nutrients, so that the body would be kept in good shape. Okay. So it's a day that is set aside to actually remind ourselves about our heart health and what are some of the problems and what are some of the lifestyle modifications that we can audit our own selves and then make sure that we enroll on. Just to make sure that our hearts, which is actually the pump of the body, is kept in good shape. And when you talk about cardiovascular diseases, maybe I should start with NCDs. So NCDs are non-communicable diseases, and these non-communicable diseases are diseases that are not transferred from one person to the other, or they are not caused by infections. Okay, they are usually caused by either your genetic makeup or your lifestyle, or sometimes environmental factors. Okay, and these diseases, we have different categories. We have the cardiovascular diseases, where we have hypertension being there, and today is World Heart Day. We'll be talking and delving more into it. We also have chronic respiratory diseases. Then we have the cancers, and then several others, which are all under the NCDs. Okay, so cardiovascular diseases, basically, we would want to talk about hypertension. And hypertension is when you have high blood pressures. So high blood pressures, I'm sure people will be asking, how high should our pressures be? And all of that, yes. So it's important to keep it simple, to keep everything simple. If you have pressures which are above 140 or 90, then we are actually gearing towards being hypertensive. You get it? And it doesn't take, let's say, just one reading for you to see that this person is hypertensive. No, it takes several readings. So at least once the first reading is done and we think that, oh, the reading is this high, then we would want to take another reading at another sitting. Maybe not too far, the timing shouldn't be too far apart, but at least about 30 minutes apart for you to be able to say for sure that somebody has hypertension. And then you would want to follow up with certain investigations as well, so that you'll be able to tell that, yes, exactly, this person is hypertensive.
Sometimes, anytime they lift the machine,
Yeah.
somebody's heart rate just
Exactly.
goes up.
Yeah,
Someone
so
like
we
my
call-
mother like this. Anytime she sees that machine, I'm like, why are you stressing? Calm down. It's just a machine. They just want to check your pressure. But there are most people like that who, anytime they lift that machine, their
They
heart
end
rate
up,
just
so we
soars
call
up.
them the white coat hypertension.
Right.
So white coat hypertension, where anytime you see any healthcare personnel, or then you are in the setting of the hospital, your sympathetics tend to kick up, and then you tend to have some high readings of your blood pressures. So that's basically it. Yes, it's there. And you need to be able to differentiate it from the different types of hypertension. So we have the essential hypertension, which is the primary hypertension, and then you have the secondary hypertension. So the essential hypertension usually is not caused by one thing. It's a myriad of
problems
things.
come together.
Yes. So it could be from genetics and aging, you aging, and some environmental factors. So when we say we have modifiable risk factors and the non-modifiable risk factors. So modifiable risk factors are the risk factors that you have control of, that you can modify, you can take charge of, and then you reduce your risks, as opposed to the non-modifiable ones, which are maybe your age. You aging, you can't do anything about it. So you aging is a risk factor in the sense that your blood vessels have been in use for a very long time. So you have a lot of distractions within your blood vessels, within the endothelium of your blood vessels. So you tend to form a lot of plaques. So you have fats, you have other things depositing and then causing stiffening of your blood vessels. So once there's a stiffened blood vessel, it will mean that you need a lot of pressure to be able to push the blood through those vessels to other areas. So that is aging, when you're talking about aging. And then you also would talk about genetics. Maybe you have a family history, mother, dad, who is hypertensive. Then you have some genetic predisposition to you getting hypertension.
Wow.
And then the modifiable ones, which are at our fingertips, or we are actually with them, we live with them every day. So diet. So diet in the sense that you taking in a lot of salt-containing food
Sodium.
predisposes you to getting hypertension. You not taking a lot of fruit and vegetables in your diet also predisposes you. Having sedentary lifestyles, not having physical activity, at least it is recommended that in a week you should have about 150 minutes of exercise. Yes, 150 minutes of exercise at least. So even if you can't, take 5 days of 30 minutes each, you have gotten your 150, and that is the least that it is recommended for you to be able to keep a very good. It sounds very simple,
simplistic, but like trust me, there are people who don't just walk, right?
Yeah,
Because it's drive from home to work, even at the office where you think they would want to use a staircase, there isn't an elevator.
Exactly.
Like there's no and at the desk they'll get some intern or some service person to be doing all the paperwork around and all of that. So I like that you hammer on this a lot. And this is more like the risk factors, right?
Yes.
I wish you could also talk about the symptoms. Because then the question would be, how do I know
that I have hypertension?
Is it like some swelling somewhere? Because people get it confused quite often.
Exactly. So so we'll talk about the symptoms, but just to end with the risk factors. So you having eating balanced diets, avoiding sedentary lifestyle, at least be physically active. I'm very passionate about physical activity. It's very, very important. And then reducing the amount of fats that you eat within your diet, and then reducing the refined foods that you eat is also one of the lifestyle modifications that you can actually do. And then knowing your numbers. You don't sit at home and then you haven't, somebody will be so confident about the fact that, for me, I have never been to the hospital before. And so, you know. Exactly. But know your numbers. Know your numbers. Make sure that at least, even if you can't do it monthly, every 3 months, just go and then have your BPs checked so that you know where you are. Because this would actually bring us to the signs and symptoms. Some of the signs and symptoms are you do not know it at all. There are no signs and symptoms at all. So the only thing that would happen is that maybe it becomes so high to the extent that you end up with complications.
So there are no signs and symptoms for hypertension?
It's a sign. I'll come to certain ones so that you can tell. Yes, but if there are no signs and symptoms,
it's also a sign.
It's also a sign that you do not. So you need to know your numbers. You need to check. You need to consciously check and then know that, okay, these are my numbers and this is how I'm going. What can I do to modify it? What can I do to make it better? You get it. And then So as I said, if you're not having any signs and symptoms, and the next thing is that you feel that half of your body is not functioning anymore, then it means that you have been struck with a complication of high blood pressure, which is a stroke.
Which is stroke, yeah.
Exactly. It could be that it's a silent, so we call it a silent killer. Hypertension is a silent killer. It could also be that you may end up with complications with your kidneys. You know, the kidney is very, very important in the body because it helps you to excrete, it helps you to detoxify the blood and all of that. So you having kidney disease because of high blood pressures. It could also be that even the heart itself, as you can see the picture that have been shown, the heart itself has pipes or blood vessels that supply the musculature of the heart to help it to do its work. So if that's those vessels are also affected, it means that the heart itself can just stop. And if it stops, that's a heart attack. You get it? So these are some of the complications that you can end up with, because as I said, it's a silent killer, and it's likely that you may not have any signs and symptoms at all. So you need to know your numbers as much as possible. Other signs and symptoms that we can talk about is sometimes you may end up having headaches. These headaches, you may feel lightheadedness. Okay, sometimes even because you have complications that can affect your vision or your eyes, you may end up having some blurred vision. All of these. And then we always say that diabetes goes with hypertension. So sometimes,
I've heard that quite often.
So sometimes your diabetic state can compound on your hypertensive state, and the vice versa.
Right.
You get it. So all of these are things that you need to know. And it saddens my heart when people come to the hospital and then, are you hypertensive? You check their BPs and it's so high. Oh, are you hypertensive? Yes, I am. Okay. Why? Have you taken your medications, or how long ago did you last take your medications? When I went, the doctor gave me the medications. When it finished, that was it.
Oh, wow.
You get it? It saddens
so
my
they're treating
heart.
it like a headache.
Thank you. They are treating it like a headache because there are no, and that is why I'm emphasizing on the fact that because there are no signs and symptoms, sometimes associated with high blood pressures, people take it for granted. And it's sad because the time it strikes you may be irreversible. It may give you some damages that are irreversible, like the kidney problems that I spoke about, like you having a stroke, you having a heart attack. You know, these are dire consequences, and we don't want any of us to get there. So it's important that we educate ourselves. We know that high blood pressure is a thing, and we need to know our numbers as much as possible.
Dr. Adam, is low blood pressure the same, or is it slightly different?
No, so low blood pressure is not the same. Low blood pressure is having pressures, let's say, below 120/80. Okay, we are worried about low blood pressures when you have signs and symptoms associated with it. It can also mimic the same signs and symptoms of high blood pressure, like you having faints, you feel faint, you feel lightheaded, and then it's like you're passing out and all of that. So once you check that, you would also have to pump. But usually for that, the body has a way of correcting itself. So even if you have low blood pressures, the body will start to correct. There's an automatic way that it starts to correct. But once you come in, you are given some fluids and all of that, and that helps to correct whatever low blood pressures that you have. Okay, but we are more concerned about high blood pressures than the low blood pressures.
So what are the stats between the two, low and high blood?
So if you have blood pressures of about 140/90 and above, that's high. Okay, and then if you have 120/80, we consider that normal. And then anything below it, so let's say low could be, if you're going even into shock, 90/40. That's very low.
Wow.
You get it? So those are some of the numbers that you need to look at. And then our weights, very important, our weights. If you have BMIs within the overweight, within the obese, they are all risk factors for developing
Sometimes
hypertension.
they say, yeah, fat shaming them, but it's okay.
You get it?
Yeah, it's
so
important.
once you go to the hospital, make sure that you check your blood pressures, one. Make sure you check your weight. Make sure you have your height also checked. And then your BMI calculated so that you know where you stand. Am I overweight? Am I within the normal? The normal is usually between 18 to about 24.9. Okay, and then anything beyond, so if you have 25 to about, let's say 30 or, yeah, about 30 thereabouts, then we say that you have overweight. And anything beyond that, then it becomes obesity and all of that.
Interesting. Will you say stress or the feeling of it is a causative or a sign or a resultant effect of hypertension?
Yes, stress can also lead you to getting hypertension. As I said, there is already an autonomic nervous system within the body that helps. So there are chemical factors that would tell the heart to pump faster. There are chemical factors that will help your blood vessels to shrink or to vasoconstrict, you know. And then once you have stress as well, you have your cortisol levels going up, you have your adrenaline levels going up, and all of these can lead to you having predisposing you to having high blood pressure. So they are all risk factors that we talk about, and then make sure that you have a peaceful life, and then don't stress yourself too much. Yes, don't stress yourself too much. Eat well. Make sure that you're incorporating a lot of fruit and vegetables in your diet. Very important. Reduce the greasy foods as much as possible. Make sure you're active.
Saying greasy foods, as if she heard me say I enjoyed the pork yesterday.
You know, it's funny because we are discussing heart and stress here, and
and our environment is stressful.
It's stressful.
Is that what you're driving at?
I'm driving at the fact that, you know, some people also experience emotional stress. And it leads to like broken hearts and all of it. I'm not a relationship coach, so I don't want to push you on that side. But is it a thing where people go through like emotional stress and they become hypertensive?
So as I said, hypertension is, you get hypertension from a combination of things. So it can't be just one thing and then you stand on that and say that just because of this, I got this or that. So you need to have a combination of them. So it could be that, yes, you are disturbed, emotionally disturbed, compounded with the fact that because you are emotionally disturbed, you don't eat well. You don't end up eating well. You're eating all the sugary foods. You're eating all the greasy foods. You are not physically active. You get it? So all of these will come together, and eventually the resultant factor would be that you end up being hypertensive. And I don't know if I mentioned it, but there are the essential hypertension, that's the primary, and then the secondary one. So the secondary one usually has an underlying cause. So could it be that you already have some kidney failure going on that can predispose you to getting the secondary hypertension? Could it be that you have problems with your hormones, if it's your thyroid gland, that you have hyperthyroidism going on, which is not controlled, that can also predispose you to getting hypertension. Could it also be that it's your adrenal glands, that, so there are these small glands that are on top of your kidneys that are producing your adrenalines and then your noradrenalines, or they are producing your cortisol and then having high cortisol levels. So from pheocytochromatosis to you having cortisol levels, high cortisol levels like Cushing's syndromes and all of that. You get it? So all of these tend to predispose you to getting secondary hypertension as well. So we have essentials and then...
We always love a little lecture. I know has a question. So after the question, maybe you could just walk us through
that as well.
The heart and some of what it plays. It's been a while we've had.
So this one says, good morning. I am watching from Swedro. Kindly ask the doctor how often one should check their blood pressure. I think you've mentioned it, but maybe you should just, you know,
this other message also says,
again.
I'm watching from Teshi. Please, I want to know the ripple effect of high blood pressure and low. I think that's also been touched on. So, yeah.
Okay. So I would move on to talk about, what was it again?
How
often, yes. So how often do you check your blood pressure? So at least every month. at least stick to a particular day and then have it checked every month. If you can't at all, then every 3 months have it checked so that you know your numbers and then you can go. And then the ripple effects, we mentioned them already. So you can have dire effects on your brain where you end up having a stroke, or you can have consequent effects too on the heart itself where you end up with a heart attack. And then when it affects your kidneys as well, leading you to having kidney failure as well. So all of these are there. So that's why I get a little upset when people come and, oh, I've stopped taking my medications, and it's like, yeah, I've stopped, and that is it.
Oh, don't shout.
You know,
yeah.
but then it's important, and that's why we are here to talk, for people to know about it, people to know that once you're hypertensive and you've been diagnosed, you need to control it. Okay, you can't cure it, but you can control it fairly very well throughout, so that you don't end up with these complications.
So you can't cure hypertension?
No, you can't. So if you have a secondary form of, if it's the primary, fine, you can't. But if you have the secondary form where there is an underlying condition, as I said, so maybe if it's your thyroid and then that is taken care of, yes, you can come back to normal. If it is the hormones and they are fairly brought back into fairly normal levels, yes, that can be. But then once you have the primary form of hypertension, which is the essential form, no. It's because of a number of items coming together, like your genetic predisposition, like your lifestyle,
your
you know,
sedentary
exactly, all of
but
that.
But are there medications that also predispose people to becoming hypertensive?
Yes, there are a lot of them. There are side effects of some medications. Some NSAIDs can affect your kidneys, you know, setting.
Then it's serious, because some medicines, so mean that even medications that you've been prescribed by
your healthcare provider would weigh.
Okay,
and then prescribe according to the need. And then, you know, when you are prescribing medications, you do them according to the dose and then also the duration. So you have short acting. You are giving people medication for this number of days and that's it. But sometimes when people end up abusing certain medications over a long period, then they may end up having some.
The messages are coming in hot and heavy. So this one says, what
So,
advice do you have for a patient suffering from heart enlargement? That's Cal from the Volta region. Do you want to answer that, or should I ask another one?
Yes, so let me answer that.
Answer that.
If the patient has a large heart or maybe cardiomyopathy, there are a number of reasons that may predispose the patient to that. So what our advice is that quickly get to the hospital and let it checked, get it investigated. You undergo certain investigations from echo to ECG and all of that, and then the right treatment will take effect.
Okay, this one says, good morning. I'm watching from Who. Kindly ask the doctor if a pregnant woman can get high blood pressure, and if yes, how should it be handled?
Yes, that is also possible. We call it preeclampsia. So some people end up having hypertension only because of the hormones and then also because of the gravid uterus. And it is, once you go through your antenatals, it is picked up and then it is managed accordingly.
So after the pregnancy, just
vanishes.
Definitely.
Most of them. But some people end up having it persisting. And as I said, it's because of how they handled it. And possibly also with their lifestyle modifications coming in.
So Doc, if you can just take us through the wrap up on that, we really appreciate, so you get a refreshed memory of how our heart functions.
Okay, so this is the heart. Okay, and then you can see that the heart, we always say, I mean from basics, we say that we have 4 chambers of the heart. So we have the atria and then we have the ventricles. Okay, so this is the right side of the heart and then this is the left side of the heart. Okay. So if you are looking at, this is the atrium. So that's the atrium. The atrium blood collects from your veins straight in here and then it goes to the ventricle. So it's pushed down, and this is a valve. This is your AV valve, your SA node. So it goes in, and then it is pumped So once it is pumped, then it goes to it is connected to your lungs as well. So where it goes for oxygenation and all of that. Once it gets there, then it now comes back through the pulmonary vessels to the left side of the heart. Okay? So once it gets to the left atrium, now it will go through the ventricle, the left ventricle, and from the left ventricle, it is now pumped to all other parts of the body. You get it? Yes. So that is basically the flow. So from the right side, it goes to the lungs, and then it comes back to the heart through the left side, and from the left side, it is pumped all the way to the other parts of the body.
Okay.
Yeah.
Okay, 2 quick questions for you. This one says, I'm watching from Pantime. I want to know how the medications work, and can I be taking them over time? And another one, what are good numbers and bad numbers considering your age?
Okay, so the first question
The first
was...
one is, what are how the medications work and can
So the medications are different. So it depends on which medication you are given. Some are calcium channel blockers, some work on your arteries, some work on your, there's something we call the RAS system, which is within the kidney. So depending on there are combinations that you can give. And then, so it depends on where the medication is going to work. So is it going to work directly on the heart? Is it an ACE inhibitor and all of that? So depending on whatever that you have, your healthcare provider would prescribe the right medications, sometimes combinations of them, so that you can get a synergistic effect of it. Okay, yes. And then it will also help you reduce the doses that you give for each of the medications. So depending on what combinations that you give, you'll be able to fairly control the blood pressures. Okay. And then the
good
second
numbers
question.
And bad numbers for your age.
Okay, so good numbers and bad. I mean, once you are young, we know 120, 80, yes, it's fine. But anything above 140, 90 becomes problematic. And especially when you are aging. Remember I mentioned that age is a risk factor, but it is a non-modified. You can't do anything about it. You are aging. You can't do anything about it, but you can. The only thing you can do is you can concentrate on the modifiable factors, where you make sure that you are eating well, because now your blood vessels have been in use for a very long time. So they are not as flexible and as, for lack of a better word, they are not as flexible, and then ability to pump as well as when you are younger. You get it? So then all of these predispose you to getting either it's the blood vessels becoming rough in there, so they can accumulate some plaque. So once they accumulate these plaque or the lipids and what have you, they end up becoming more stiff than usual. So when they are stiff, that means that the heart has to work harder. And then this predisposes you to getting high blood pressures, as opposed to somebody who is younger and doesn't have all of these plaques within the blood vessels and can easily, okay, so the word has come now, elastic. That's what, it's not as elastic, you know, as you were when you were younger. You get it? So all of these predispose you to get it. So anybody who is aging, I would say that at least even look at numbers less than 135 to about 85. Yes, you should look at maintaining your blood pressures below those. Don't even get it to the 140 or 90.
Doc, there's so many questions here that unfortunately we can't go through. This one's asking, he's watching from Sasebi, what causes blood clotting even though you exercise a lot?
Blood clotting, okay. So blood clotting.
Also add a pregnant sister.
Yeah, a pregnant sister has been diagnosed with an anomaly in the left ventricle of the unborn child. What could be the cause and of that and the possible effects to the baby?
Okay. All right, so the first one was anomaly, right? anomaly related, no, the
blood clotting.
Yes.
Blood
Yes. So
clotting.
as I said, blood clotting. So our blood, we have our blood flowing through our blood vessels or the pipes. They are flowing without clotting. When you say clotting, it means that you have moved from a liquid to become solid or semi-solid. Okay, so that is what's basically it means when you see the blood is clotting. And usually is as a result of damage to the inner lining of the blood vessels. So the endothelium, once it gets damaged, then you can end up having these clots forming. But the body has a way of taking care of these clots when they happen. All of us end up getting micro damages day in and day out.
Right.
But our body has a way of taking care of it. There are certain mechanisms that come in to cause fibrinolysis of these fibrins that form. And then these clots go away. But then if you have other predisposing factors, like high levels of lipids that have lined your vessels, it makes it a little more difficult for the body to take care of it. So that these clots can persist, and then they can end up growing. If they grow and then they dislodge, and unfortunately they dislodge and then they embolize. That means they start moving and they go and clog another vessel and then block the blood flow to that vessel. Then that becomes more problematic.
Time is
for
gone,
us.
but I want her to address the final
I
question.
think answer the questions next week because we have. I know, Dr. Ado. Thank you
the show for the
so
listeners,
much.
the
Yes,
viewers.
we do. So
Anyway,
definitely answer the questions next week. But